All right, good morning, and thank you for joining us today for an IAAP member webinar, MSHA and OSHA compliance and workplace safety and health considerations during COVID-19. Thank you for joining us. For those of you who have joined me previously for webinars, welcome back, and thank you for coming in today. And for those who this is your first time, welcome, and I hope that you find this to be some worthwhile information. So thank you again for those who may know me already. I am Nick Scala, and to those of you who don't, welcome. So I am the chair of the National MSHA Workplace Safety Practice Group for Conn, Maciel, Carey. We are a boutique firm that practices in workplace safety and health and labor and employment all over the country. We're headquartered out of Washington, D.C., but we have offices in San Francisco, Columbus, Ohio, where I'm based, and also Chicago and Atlanta. We represent employers in a wide range of matters, from mine safety and health to occupational safety and health, whether from the contest or enforcement, or largely what we've done in the COVID space is education and guidance and helping develop those policies and programs to ensure that you are being compliant and avoiding that possible enforcement down the line. And that is what we've been doing quite a bit. Like most people, we have been rather saturated with COVID-19 and focused on it for the last 4 months, which is crazy to say since we are in month 4 of really being in this lockdown to an extent. Whether we're operating at full capacity or limited capacity, it depends on your industry and your work. For the mining industry and the construction industry, almost from the get-go, you've been considered essential businesses. So you've maintained operations at a relatively normal pace. Perhaps your office staff or administrative staff has been working remotely or work from home, and maybe they are coming back in slowly or still working from their houses. But nonetheless, we want to take a minute and somewhat refocus. I've heard people say that they are, saturated or overwhelmed by just the constant barrage of news and reporting and the topic of COVID-19. But it's important that we also take a moment to review what we know to this point, what guidance has come out, what specifics or answers we do have from our regulators, and also what best practices have been developed over the course of the last 4 months. Because what we're seeing is that the pandemic is now starting to resurface, maybe and spike in much of the United States. And we're going to be dealing with this for the foreseeable future. And while we get more comfortable dealing with it and putting in effective policies and procedures, the regulators are also getting more used to dealing with it. There's less triage, and now they are getting increased pressure to focus on the enforcement side. And that is both MSHA as well as OSHA. And OSHA, really, we're going to talk about them a lot today, which I know is not what we typically do when we have webinars for everyone and the association, because we focus on MSHA. But really, we're going to spend a lot of time today talking about OSHA. And the reason that is because MSHA has provided relatively minimal guidance, really minimal guidance, especially in writing, and especially when we're comparing it to OSHA. And so for the mining industry, when we're looking at a regulator, a lot of the information that we aren't getting from MSHA has already been published in some way, shape, or form for OSHA and its intended audience. Most of you probably have crossover operations where you're under both jurisdictions. And in many cases, looking at the COVID response of OSHA is going to give us a lot of helpful information for how we can prepare and manage our MSHA practices or MSHA facilities. So our agenda, we're going to talk about the MSHA implications and some changes we've seen, then OSHA. We're also going to talk about your effective exposure control and response plans. And if you don't have one of these plans at this point, I really recommend that you work to put one together or implement one, or let me know and I'm happy to help you out and share some resources there. But this is a very important aspect, not just from controlling it from a regulatory standpoint, but also we're going to talk a bit later about some other possible legal areas that have been impacted by COVID-19, and the exposure control plan is going to help it just be a general defensive document, while also letting your employees know that you're taking this seriously and that you care about what is going to be happening to them, and that you're taking best steps and best practices as we move forward. And then lastly, we're going to talk a little bit about some of the Illinois-specific guidance and reporting to MSHA and OSHA, because that is a question that we have been getting quite a bit. So, what is MSHA doing here? The screen right now has on it the orange italicized phrase, which comes from MSHA's COVID response page. And it says that MSHA will continue to perform its essential functions, including mandatory inspections, serious accident investigations, and investigations of hazard complaints that are of the imminent danger or serious in nature. Well, you know, other than educational field services, that pretty much encompasses the majority of MSHA's mission. So we, you know, what does that tell us? We're looking at an agency that hasn't taken a great deal of changes to their operational status. And now OSHA, we saw a big drop in their on-site presence. MSHA, there was a slight decline when COVID really began, but we did not see this sharp decline. And a lot of that has to do with MSHA's mandatory inspection requirements, their 2s and 4s, as we know. But nonetheless, you know, this statement, I think, just kind of should make us all aware of the fact that while MSHA is taking some steps in response to COVID, they are going to continue to perform their enforcement function. So MSHA has been putting their inspectors back out in the field. For the most part, I've heard relatively positive responses and information about how the inspectors were conducting themselves. You know, at first, giving a good bit of social distance, adhering to masks while engaging with the mine employees. I hope this continues. We should also feel very confident and very comfortable if we have a mask policy, which we should have a mask policy or facial covering policy when you're not working at social distance or you're not working at in an isolated environment such as an office or in a piece of equipment by yourself. We should feel very comfortable, though, informing MSHA of those site-specific guidelines and holding them to that. And if you're not getting cooperation from your inspector on the front that they won't wear a face covering when interacting or talking, or they won't adhere to social distancing even when it's feasible, you know, you need to be determined in that you're going to have that be followed on your work site. And if the inspector is really not cooperating, you need to consider whether or not you should be reaching out to their field office supervisor to discuss that with them, because Assistant Secretary Vitezalel has said on multiple occasions that we want to work with the industry on this and that our inspectors should be taking the best practices seriously. And now what MSHA has told us is that they want their people to follow, and the mining industry to follow, CDC guidelines. Those are some of the key elements of CDC guidelines: wearing facial coverings and maintaining social distance. So while MSHA has taken, again, a relatively backseat to just see how the industry manages on their own and refer everyone to CDC guidance, there is mounting pressure right now on them as an organization to put forth some additional enforcement tools that would allow them to get a bit more aggressive in how they are regulating COVID-19. One is a piece of legislation that was introduced in the Senate. It has not been passed. I don't believe it's even been voted on in any shape or form right now, but it is the COVID Mine Worker Protection Act. This would require that MSHA put into place an emergency temporary standard regarding COVID-19 transmission in the workplace, and it would be something citable. Similarly, there's been litigation filed against MSHA by the United Mine Workers and Steel Workers, where they've sued MSHA in the District of Columbia Court of Appeals on the Federal Circuit in order to have an emergency temporary standard put in place. It's worth noting that another labor organization, the AFL-CIO, tried this same tactic with OSHA in the same court not that long ago, and it was denied. It was failed. The court deferred to OSHA. I would anticipate that something similar is here, especially because unlike OSHA, where you have explosions in clustered cases in meatpacking facilities is one that we've heard a lot, and in other types of manufacturing, you haven't heard of the same clusters appearing in the mining industry. So I would expect that similar to the suit against OSHA, this one against MSHA will be shot down, but we need to monitor that. And it's also worth noting that the mine workers and the steel workers unions are the same unions that sued MSHA in the DC circuit to have the workplace exam rule for metal non-metal mines changed back to its 2017 status from what it was amended and a bit softened to allow for a little more industry freedom in implementing it. So the same unions are again trying a similar tactic in order to get MSHA to have an enforceable standard, because then the agency can go out and write citations for individuals not following what is included in that standard. Maybe it is social distancing, maybe it's a regular cleaning schedule. We would just have to wait and see. So as I said, the guidance has been minimal from MSHA. We have just recently seen them put up a few flyers in conjunction with the Centers for Disease Control. I've included just a screenshot of one of the two flyers. It's pretty straightforward stuff, okay? They're just outlining, again, the CDC guidance, and, really they put mining in the title and a hard hat on it. So not a great deal of specific guidance for the mining industry. They put out another one regarding guidance or recommendations for miners who may have a serious underlying medical condition. And those conditions are anything from COPD to heart conditions or obesity or chronic liver conditions, anything that really just makes you high risk in the normal setting. They'll put out an additional resource for them. And it simply really goes over the same items. Here are the symptoms of COVID. You should monitor for symptoms. You should take these best practices to put in place. We'll review it in a bit, but OSHA has published a great deal of information on this. They, at the very beginning, back in March, published a helpful and a detailed COVID-19 in the workplace guidance document, which really gave the industry a good bit of information on that. And we continue to see pretty regular publications coming out from them. So again, that's why we're going to talk about OSHA probably more so than MSHA today. In terms of enforcement changes, though, there have been some relaxing with MSHA, where they've specified in their COVID resources these 4 areas where they are going to give people eventually a stay on enforcement. So we know that typically we have to have our annual refresher training done within 12 months of the day it was previously completed. They are saying that you can wait until the presidential emergency order has been lifted, and then you have it's not a specific amount of time, but then you will have some amount of time in order to get that training done. Now that is so that you don't have to put a bunch of people in a room together where they can't social distance, and you could be potentially hazardous for transmission. Similar, they are tolling or staying enforcement on a couple certifications. They are not saying that you do not have to have these for 2020, though. They are just saying for the time being, we aren't going to issue a citation if you had to cancel these certifications or cancel this training due to COVID-19 concerns. It isn't listed here, but in stakeholder calls, CPR and first aid training have also been thrown into this. Mine rescue training for underground operations and coal operations, and also fit testing if you do require the use of respirators. And that's the annual fit testing, not the initial fit testing. So, we're looking at it. There is some relaxation. We're going to look a bit how we can protect ourselves and relying on this when we review some of the OSHA guidance, because they actually have outlined what they consider to be the steps that you can take in good faith to show that you were trying to be compliant, but were unable to. You want to really just use your best judgment, though. If you think it's possible to do something virtually and it can be effective, then those are new technologies that we're all exploring more. If you get a citation for anything like this that you weren't able to do because of MSHA or because of COVID, you need to be prepared to push back on that and contest it. I think from my understanding, my interaction with them on this, that the MSHA management is going to be willing to work with the industry. So unless it's very egregious, you know, you are going to get some relaxing and maybe some more working together on those fronts. Now, it is important to mention, and I'll say this a couple of times, this does not apply to new miner training or task training. So make sure we are still conducting that, and we're going to have to do it safely and as safely as possible, but you cannot put someone out there without their requisite training. If they have an annual certification or their annual refresher, that's a different matter, but you cannot put someone in the field that does not have their required training. In terms of enforcement, we haven't seen a great deal of citations as a result of COVID. There have been a few, but you know, what are some areas where we need to be somewhat on guard? MSHA does not have a general duty clause to issue these citations under. OSHA does. I'm sure MSHA wishes, and they've tried before, to, you know, put a general duty clause into a piece of legislation, which would essentially give them the ability to issue a citation for a condition, even if they don't have a specific standard on it. And we'll go through those in a bit more detail in a few slides for the OSHA perspective. But where are some opportunities with MSHA? Well, a lot of mines, you know, idled. Maybe it was due to demand at one point or another, or shut down operations temporarily. You know, hopefully most of those are coming back online or are online. But don't forget that you have the obligation to notify MSHA of your operational status when you're shutting down and when you start back up. Okay, so you need to make sure that you're doing that. That can be a citation. MSHA has asked throughout this that everyone just kind of give them a heads up if they are limiting their shifts or having a workforce reduction or only operating parts of the mine as opposed to the entire thing, and that is so they can gauge properly their inspector resources. But just don't forget, you know, they're asking you to do that out of goodwill, but there is also a standard where they can cite you for not notifying them if you're shutting down or restarting. Also, workplace examinations. It's a very broad standard. We don't think of it with respect to COVID, but it is for hazards in the workplace that could adversely affect the safety and health of miners. So if you do have a situation, or if a mine has a situation where there is an outbreak and there isn't enough action being taken, I think that is an area where they could try and sneak one in, that you weren't inspecting the workplace, you weren't cleaning the workplace. You know, it's a loose option, but it is something that I could see them going for, just because workplace exams are very easy and low-hanging fruit, because there is inherent adequacy requirement coming from a commission decision a few years ago. So again, a bit difficult, but an option. A bit more straightforward is 5657-15006, because that is having the appropriate clothing or PPE for hazards or irritants. So we want to make sure that we're evaluating it. We don't have the same obligations as we do with OSHA, that we have to require to do a PPE hazard assessment. But if we have individuals who are cleaning now more than they did before, or using a new cleaning agent, we need to make sure that they have the appropriate PPE for that. And that also ties back into the last bullet point here, which is Part 47, our failure to update our HAZCOM program if we have new chemicals on site. There was a lot of concern and supply chain shortages at the beginning, and I think that's an area that, you know, we want to make sure that we're continuing to have all the proper HAZCOM training and communication and materials on site for anything that we've brought on. And then the last thing is just Part 46 and Part 48. We still have to do site-specific training. We still have to do new miner training. We still have to do task training. Make sure all those are completed. Don't get misdirected with this kind of relaxation on the annual refresher to mean it's for anything else. Additionally, when we're talking about task training, if you have people who are now going to be involved in, you know, deep cleaning, whereas maybe they weren't, you know, the whole task training thing is always a chicken and the egg situation, because how far do you have to go? But if you have people that you're training to come in and do cleaning, or to do cleaning for the purposes of preventing or cleaning up after a COVID case, you know, you recommend that you're probably going to need to look at new tasks for those persons. If you have a COVID positive case, at the facility or in an office, I highly recommend that you bring in a third party who has expertise in that area. But if not, you most certainly need to be training and providing the appropriate PPE for people doing that kind of cleaning. So with that, we'll take a look here at OSHA. And again, I welcome anyone to answer or ask any questions you might have in the chat. Or I know I'm moving quickly today. There's a lot of information to cover, and I'm trying my best to keep us at within our hour time frame. But don't hesitate to reach out to me afterwards with any questions, whether by phone or email or any other means. So what are we seeing on the OSHA side? Well, OSHA really stopped a lot of the on-site investigations as this began. Some of the attorneys in our firms with OSHA even did virtual investigations or inspections where they had individuals at the company go walk around with a tablet on a video and a live screen share and show OSHA different areas that they requested to see. I don't think we were seeing that with MSHA, but now OSHA is looking to get back out there. So they are having some new inspection framework. They're looking at areas, two different kind of frameworks, where there's areas where there's community spread has significantly decreased, and then the other one is where we haven't seen that reduction. So in areas though where the spread has significantly decreased and it's for low and medium risk exposure level workplaces, they are going to start returning to normal inspection. And they're still going to be prioritizing their COVID complaints and cases, and there has been thousands and tens of thousands of COVID-19 workplace complaints that have been fielded by OSHA, and then we've helped the clients go through many of them and respond, which is another reason why having that robust exposure control and response plan is important, because in those situations it is a very good tool to have. But they're also going to be looking at their rapid response investigations, and then they're life critical and programs. So, again, that's going to be serious injury. They really didn't stop those to the great extent, but they did try to limit and do as much as possible remotely. The second is going to be in areas where they're experiencing either sustained or elevated transmission, and they are really limiting that just to the fatalities and imminent dangers, and then those involved in hospitalizations using the rapid response investigation tools. So, there is a lot of increased presence right now that we're seeing in the last probably 30 to 60 days. 30 days. And this is well beyond, obviously, the May 19th guidance that we're talking about here, but we are seeing OSHA in the field a lot more. We are seeing MSHA, kind of come out, and they might have hit the pause button, but they are now getting all those inspections in. So, we should expect our regulators, if they haven't been at our facilities, and we were expecting them, that they are going to be there relatively soon. Now, as we talked about before, MSHA has kind of loosened the rein on a few specifics, and OSHA has as well. OSHA, though, has been given employers a rather detailed framework of what they expect in order to find that you made good faith attempts to comply, but were not able to due to COVID. And this is a framework that we should really take to heart, because while MSHA has not put it out there as they are expecting these kinds of actions to have taken place, it is the best way we can help defend ourselves in the event that we do get any citations or allegations that we weren't complying. So OSHA really put this out, it was a couple months ago, but it looks at if an employer is unable to comply with a standard that requires annual or recurring duty. So that's what we were talking about with the annual refresher recertifications. And this also is talking about, annual audiograms is another area where we've seen it. And the employer made a good faith attempt to comply. OSHA shall take such efforts into strong consideration in determining whether to cite a violation. So we want to look at what are those good faith attempts. And, it says down here, and the same is true with MSHA, that also OSHA expects employers to make good faith attempts to return to normal compliance as soon as normal operations resume. Are operations ever going to return to exactly what they were before? Who knows? Possibly not. Could that not be till 2021? That's very possible if we're waiting for a vaccine to come out. but we need to be making these attempts and trying to schedule things out further. And so what are we looking at as evidence of our good faith attempts? Do we have contracts or invoices that show that we had things scheduled, whether it was a training or a recertification or our annual audiograms or fit testing, and then we had to cancel them because of COVID? Do we have communications with vendors where either their procedures or their internal guidelines said that they could not travel for work or canceled because of the pandemic, or vice versa? Do we have our regulations showing that we do not allow visitors on site still at this time due to health and safety reasons? Also, again, we talked about earlier, have you been exploring other options that might be feasible, whether that's virtual or otherwise? Doing the training in smaller groups, or doing it in a way where you can maintain social distance in larger forums. So those are going to be things that OSHA and MSHA will look at. MSHA just hasn't laid them out quite as clearly as OSHA has here. So, you know, we want to also look at what we're doing in terms of implementing engineering controls and administrative controls, because those are items that will also be taken into consideration. Have we increased cleaning? Have we put up plexiglass barriers to divide workplaces? Somewhere that comes to mind there that might be more akin to what we're doing, if not an office space, is going to be a lab, or maybe the scale house where we're handing out tickets. Have we tried to make that at least a relatively guarded process where it's electronic, or we don't have face-to-face contact? Or if we can't provide that, we put up a plexiglass barrier to divide the drivers and the individual who is operating the scale and handing out the tickets. So things that we looked at there, what have we done to try and improve these situations and these potential exposures? So, you know, we want to look at that. It's important that we continue to push forward and keep making attempts. If you did have someone cancel a vendor, or maybe you canceled them due to health and safety reasons, you want to make sure that you're keeping in contact so that you can keep looking at and monitoring the situation to see when you can get that training done. And a written log or email correspondence, something along those lines, is more than enough in order to help establish that, so that you can at least keep track of what you were doing. So another area where MSHA has not given as much detail is respiratory protection enforcement relief. So, you know, we've all heard probably previously of N95 respirators, and if we had not heard of those before March of 2020, we certainly have heard of them now. So what we saw, though, is that at the beginning of the pandemic, when businesses were being shut down and the healthcare system was ramping up in order to try and accommodate the impending rush of patients, who was being asked to donate all their PPE? Well, industry that had PPE, and many times that's construction and mining and manufacturing. So much of the PPE, you know, was donated as long as it wasn't essential for operations, and then the supply chain difficulties. So there have been some relief that has been offered, but it is not total relief. MSHA's Assistant Secretary has stated that if someone is supposed to have an N95 respirator or a half-face respirator or something of that gauge to perform a task, just because supply chain shortages might exist does not mean you can put them out there with less protection. So if that is the case, you need to be looking at, again, new engineering controls or administrative controls to lower exposure levels to whatever that contaminant was. You know, you need to look at what else can we do? Do we have to increase the type of respirator to a more robust system in order to offer the same or similar protection just because we can't get our N95s at this time? Similarly, if we have individuals who are using N95s and they don't necessarily need that level of protection, that's something that we want to reevaluate. If they're doing so voluntarily in the OSHA perspective, they can. You need to still provide them with the pendency of a respiratory protection program. If you are requiring individuals, though, to wear N95s, you still need to implement on the OSHA side that full respiratory protection program. And similarly with MSHA, if you're having them wear those respirators, you need to put that respiratory protection program into place. So what have we seen, though? There has been an OSHA temporary enforcement memo that relaxed respiratory protection enforcement. Again, the annual fit test, which is usually a destructive fit test, they have given some relaxation there. MSHA has likewise said that we will offer similar relief. OSHA is allowing you to reuse respirators beyond the manufacturer's recommended life as long as you are still cleaning and maintaining them as best you can. And in some instances, you're allowed to use other non-OSHA approved respirators. The KN95 is one that we've heard a lot, and it comes from China. But there are quite a few operations around the country that are now having to put together programs which then allow them to use this K95. So, you know, different areas that we can look at. You still, though, have to have those little essential elements in place, and you have to be careful that you are not getting too relaxed with this. Again, we're looking at respiratory protection here, which is different than face masks, which we'll talk about, or face coverings in a few more slides. So you still have to perform those initial fit tests. You still have to check and make sure the fit check is giving an adequate seal. Again, we're not going to be able to have the facial hair, which might impact that. And you also, as I mentioned before, you need to make sure that you're training on proper storage, cleaning, and inspecting to make sure that they are not using respirators that might have damage to them or storing them in a way that puts more damage. But otherwise, you are going to get some relief in the enforcement side on the specifics, and that is trying to recognize the difficulties that are in place due to supply chain. Also, we have, in terms of possible enforcement relaxation and other items, is the general duty clause. And we talked about this with MSHA when we outlined several standards. And really, you know, OSHA does not have an airborne contaminant, airborne virus standard. I believe that one of the only states in the country that does at this point in time is California. But we are seeing a number of state plan states that are going through and starting to talk about whether they're going to be putting forth COVID-specific enforcement regulation. Virginia has considered this, and there's actually some impending regulation on it. Washington and Oregon also have state plan states which are looking at doing this, and as well as California, it's been discussed. So could we see these push OSHA in a certain direction? I think right now OSHA is standing rather firm without having an emergency temporary standard, but again, we're going to have to see how long this goes. Does this continue to be an annual thing where COVID viruses or the COVID mutation in viruses present something like the flu strain, where there is an annual mutation that comes out and that we have to prepare for? That may drive future regulation, but for now, the best area, probably the most likely area where we could receive an OSHA citation, other than reporting, is going to be the general duty clause. So as I mentioned before, the general duty clause allows OSHA to issue a citation in a circumstance in which they do not have a specific standard in place. The general language of Section 5A1, which is the general duty clause, is each employer shall furnish each of his employees an employment and a place of employment which are free from recognized hazards that are causing or likely to cause death or serious physical harm. So the four elements are: a hazard exists in the workplace. Probably not going to be able to argue that COVID-19 does not exist in the workplace. The employer or its industry recognizes a hazard. Again, very difficult to argue counter to that. The hazard is likely to cause death or serious injury. Again, I think that's one that's a bit more gray, right? Like, what is likely? And then a feasible means exists to eliminate or reduce the hazard. And obviously the elimination is going to be very difficult, but reduce. You know, this is going to look at, are you taking proper precautions? Do you have that exposure control and response plan? Are you limiting persons to working in groups? Are you requiring facial coverings or face masks? These are some of the areas where we think that this can come into play. We haven't seen a great deal of enforcement on it, but again, the regulators are starting to get some increased pressure as we get into, you know, the better part of half a year where this is a precedent in the workplace. So we will see what happens as we move forward, but this is a likely candidate for what could be an enforcement tactic in the future. Also part of that is, I mentioned at the beginning, OSHA put out this guidance document. It's a good document. If you have not looked at it, I would recommend it. It isn't a detailed roadmap that has, no need for clarification or no need for interpretation, but it does provide some good information about how to determine which level of PPE your persons may require in the workplace, or evaluating what kind of workplace you might have and some best practices to get a bit more safe. So it talks about engineering controls, it talks about admin and safe work practices and PPE. From an engineering control perspective, obviously I understand that most of our workers are working outside on a daily basis, and that, relatively speaking, that is one of the safer areas for transmission. But if we do have people working indoors, or if we're bringing back office personnel to a limited or even to a full extent, and able to maintain those distances or have them wear the face coverings, you want to look at some of the HVAC options in terms of increasing that ventilation rate, or installing better filters, or even, as we talked about before, those plexiglass barriers that can help divide up the workplace. Admin controls, most jurisdictions, the federal, state, local, are, at least recommending that everyone, to the extent feasible, keep workers that can work at home or work remotely, remote. And I think that's something that we're going to see as an admin control for a while. It is something that is not going to change, but obviously for essential businesses and for people that are in the manufacturing, construction, or mining industry, that's not really an option for the most of the workforce, or the majority of the workforce, I should say. So, are you requiring sick workers to stay at home? Are you doing symptom checks and making sure that they are aware of your expectations and also what they should be looking for? Are you looking at staggering your shifts so that you don't have, if you have a large workforce coming in at one time, are you having them stagger that so that you can reduce the amount of people in a certain area? Same could go with breaks and break rooms. Are you reconfiguring those to have social distancing taken into consideration? Are you staggering your breaks so that people don't congregate in large groups? These are certain things that we want to look at. Are we making available hand sanitizer and cleaning supplies, or the necessary protective equipment, such as, again, the face masks and respirators if needed, face shields if you're having a lot of interaction with individuals, gloves, etc. So these are things that we want to take into consideration, and this is a bit more built out list of what we just talked about, but the first bullet is where all this should be located, and that is this exposure control and response plan. And again, I implore you, as a company, if you do not have this physical document created at this point in time, you need to do so, just because this is going to be, one, something that outlines anything. It's just like a lockout tagout procedure. It's just like a HAZCOM procedure or program. We need to have that detailed program in place, one, because it outlines expectations and it outlines what we're doing to protect the workforce. Also, it is a very good defensive document from regulators in the future. We're going to talk very briefly at the end here about a change in the workers' compensation program regarding essential workers in Illinois, and the rebuttable presumption that that employers can provide they were following certain programs. If you have an exposure control plan, this is going to be a very easy way to highlight these. Hopefully, if we have the program, we're implementing it, and I would assume we wouldn't go through the effort of developing one not to implement it. But this is a very important document. So I would really recommend that anyone who doesn't have one look at it or look into it and start preparing one. If you do have one and it was created maybe 3 or 4 months ago, look at having it reviewed for any new guidance and make sure it remains up to date. This is an evolving area of law. This is an evolving area of workplace safety practices and workplace safety expectations. So you want to make sure that you're continuously reviewing it so that you have the accurate information in there. And again, if there's any questions on that, please feel free to reach out, and I'm happy to assist there. But some of the things we want to have: the signage and communication, not only for our own employees, but for guests. Are we outlining our expectations when they come on site in terms of social distancing, in terms of masks or facial coverings? Are we providing those cleaning supplies? Do we have an enhanced cleaning program, whether that's with a third party coming in, maybe doing weekly or bi-weekly deep cleans of the facility, or if we're having equipment that is used or tools that are used between multiple persons or on different shifts, are we cleaning those in between the shifts? And with some kind of disinfectant. I'd encourage that if you are going to be doing or using disinfectants, that you look at, ensure that they are one that is going to be able to disinfect and kill the virus. The EPA controls or maintains a list of products that will kill the COVID-19 virus. Also, there is a list that is growing right now that identifies hand sanitizers that may have a presence of methanol, which is dangerous to be absorbed in the skin. So you might want to make sure that your hand sanitizers that you're providing to the workforce aren't included on that list, and that they have at least 60% ethyl alcohol in them to kill the virus. As I mentioned, these exposure control plans, they should be tailored to your specific site. There isn't a one-size-fits-all. There's a lot of different aspects of them that can be carried through between sites, but they are going to have to be site-specific or industry-specific, even if you have sites that are similar. And this is also an effective way just to put it into the communication and to let your employees know that you are caring and you are taking this seriously. And that's also an important aspect. We don't want our workforce to become jaded in our approach to anything that's happening or anything that we're doing. A big question that comes up is employee or visitor health screening. This is not required. It is recommended really nationwide, and specifically Illinois calls it out as a recommendation as well, that you look at the temperature and or symptom checks. So symptom checks, again, that can be a self-assessment that the employees do. Same with temperature, that can be a self-assessment that the employees do. If you are looking to do temperature checks though on everyone entering, that you need to be very careful in what you are putting forward. You need to evaluate different methods. Again, self-assessment versus you providing individuals that will do that. Who is going to take this testing, and do they have the adequate training and the adequate protective equipment in order to do it? Where are you going to have this testing take place? We've talked with a lot of clients and helped a lot of clients put these together. We think one of the best options is to have it done before people even get out of their cars, if you're going to do it on site. So have them drive into the facility, they get their temperature screened at that time, non-contact thermometers hopefully, and if they do have a temperature that is above the recommendation, they just turn the car around and they go. They haven't even been in a public space or near any other persons at that point in time. If we are going to be recording temperatures or doing the screening, it may be considered a medical record under the ADA that we have to maintain for 1 year. It could possibly be considered a medical record by OSHA, which means it has to be kept for the life of the employee's employment and then a duration of 30 years post-employment. So we want to be careful what we're putting on the documents in order to help eliminate that risk. So we don't want to document the actual temperature or symptoms, yes or no is good, or an enter or do not enter, meaning, they're approved to enter the facility or not. Something that is relatively basic so that we're not getting into this medical evaluation. It's an important aspect that we want to be cognizant of if we're taking these actions. Again, this is a very brief review of employee screening procedures, but you want to make sure you're conducting the test in a non-discriminatory manner, you're maintaining confidentiality of the test results, and that goes doubly if anyone ever comes down with the virus at the workforce. Management needs to make sure and maintain that confidentiality, even if the workforce is aware of who contracted the virus. You know, you want to have the proper protocols in place for people who may refuse it and use your consent acknowledgement forms. And then also you want to establish protocols for notifying individuals of the results. It's also, this is, you know, something that it should be happening concurrently if you're going to do the temperature screening, but it's also, you can require individuals who are coming back to work to take the COVID test. Now, this is not the antibody test. That has been put out in some EEOC guidance from about the last month, where employers may not require an antibody test as a return to work condition, but they can require the COVID swab testing. The issue with this is you can't have false negatives, and even if there is a negative result, it doesn't mean that the individual is not COVID positive in the next day or so, because of exposure that happened after the test took place. So, you know, it is something that you can require. There is some benefit to it, but I mean, right now, I think we're seeing these surge in cases, and I'm reading that there is a 7-day lag time on getting test results. Well, that's 7 days of exposure. So you might find out that that person was COVID negative at the time that they took the test, but what have they been doing for the last 7 days? So, and an interesting option, but there are some deficiencies with it. When we're talking about the cleaning and sanitation and disinfecting, this should be an enhanced daily cleaning process that takes place. Again, tools, equipment, anything that's shared, you want to be making all those disinfected on a daily basis. If you are in a OSHA environment, you're probably going to be having to do temporary PPE hazard assessments to see what is necessary in order to provide this cleaning, what new PPE requirements might be required due to the chemicals, as we talked about earlier. You want to consider those third parties, and especially in office environments. Again, I know that being out in the mine is a bit different, but to the extent that you do have areas that are frequented or high traffic, you might want to consider having a third party come in, or some kind of professional on some type of regular basis. You know, I'm not going to tell you how often that has to be, but to do deep cleaning. And also make sure that you are looking at your state and local guidance, because they might be putting out different guidance than just the feds. So it's something that you have to keep in mind throughout this. On the face mask or face covering front, and I say that because that is different than a respirator. You as an employer may require the use of face coverings in the workplace. You know, most states, including Illinois, require them if social distancing cannot be maintained. In order to be an effective cloth face covering, the CDC has listed 5 criteria that they want to see: that it fits snugly, that it is secured, that it is multiple layers, and there's breathing without restriction. And that's an important element, because that is why we have to go through those testings within part of a respiratory protection plan. And that it can be laundered and machine dried out without damage or change the shape. So we can look at these, we can require them. Individuals who want to bring their own, that's fine. We think that we recommend that employers provide them and pay for the masks. If someone wants to bring in and voluntarily wear their own N95, you know, they can do that. Again, even if they're doing it voluntarily, you need to provide them with Appendix D from at an OSHA facility. And if you mandate use of an N95, again, then you're going to come into respiratory protection. But for these face coverings, they are not respiratory protection. Okay, they're not considered PPE unless they are being used to protect workers against splashes and sprays. As you can see, they were surgical or dental masks. OSHA, because they aren't PPE, employers don't have to pay for them under 1910-132, which is, again, that's going to be general industry on this. But MSHA has, again, looked back at that general duty clause and said that if the masks or face coverings are intended as a feasible means of abatement in a control plan, again, that exposure control and response plan, that employers could be required under the general duty clause to provide them. So again, that is why we say that we recommend that you provide and pay for masks for the employees. if you're going to require them on site. When we're looking at this next, what happens when we get a confirmed case on site? This is all pretty straightforward, but sometimes the straightforward things are what we need to make sure that we think about and have in that plan. We want to immediately isolate that employee, remove them from the workplace, have them self-quarantine, do a deep cleaning. If you have a confirmed case, I very much recommend that you get a third-party contractor in there that knows how to perform deep cleaning in this kind of environment. Do some contact tracing. Who else did they work with? Who else were they in close contact with? If they were in close contact with other people, meaning within that 6-foot barrier, then those people probably need to go in self-quarantine as well. If they just were in the general workforce but weren't working closely with people, those people have no symptoms. They can remain at work, but let's make sure that they're wearing their masks, they're doing improved, additional hygiene with hand washing and hand sanitizer, and that they're continuously monitoring for symptoms. If we have someone who comes down with a positive case of COVID-19, when can they come back to work? So really this is based on CDC guidance, and it comes down to 2 scenarios. Did they have symptoms or did they not have symptoms? And then you have a symptom-based review and a test-based review. So if an employee had symptoms, they can return to work under a symptom-based strategy at least 3 days, if it's been at least 3 days since recovery, which is no fever without using any fever-reducing medication, and at least 10 days since the first onset of symptoms. And that is an and. So both of those have to occur. If you're using the test base, there has to be a resolution of the symptoms, same as before, and you have to have negative tests on a COVID-19 molecular assay from at least 2 consecutive respiratory specimens collected at least 24 hours apart. The other side is what happens if they did not have symptoms, but they maybe have a positive test. So again, 10 days in the test time-based strategy, so 10 days since first positive COVID-19 testing or test result, or the test base, they have negative results on those 2 consecutive. And the reason those are more concise is because you're not dealing with a resolution of symptoms. So those are areas where you can look at when people can return to work. Now, the question is, are these reportable to MSHA? Are they reportable to OSHA or recordable to OSHA? As there is a distinction with OSHA between recordable and reportable. With MSHA, we have the 7001 form. Now, the Assistant Secretary of MSHA has stated on multiple occasions that they do not consider COVID-19 a reportable incident unless it can be confirmed it was contracted at the mine and place of appointment. So when might that occur? We're going to talk about that in the next few slides with OSHA because they perform or provide a more detailed framework, but really you're looking at, were they working closely with someone who had it? Did you have a cluster come out of the mine? Those are areas that they're going to look at. Maybe at that point you need to submit a 7001, but for the most part, MSHA is not looking or expecting companies to submit a 7001 unless they can prove that it was work-related or contracted at the place of employment. They are requesting that you provide them information voluntarily if you have someone who comes down with COVID, but that is to help them track that and also to assist, again, in that allocation of worker resources or inspector resources. Part of this case that was brought by the unions is saying that, miners are at heightened risk given their working conditions. It focuses mainly on underground coal and its descriptions. But part of MSHA's response is we have not received information and we're not aware of information that there has been significant clusters or kind of breakouts in the mining industry. And so that is one reason where they're saying they are using it as a defense to why they have not put out an emergency or temporary standard. So providing that information helps them know what is going on in the industry. But again, that can be done voluntarily with a phone call or an email as opposed to submitting that 7001. Is a confirmed diagnosis of one of my employees recordable on my OSHA 300 logs? It can be. The employers only have to record a COVID-19 if it's a confirmed case and it's tested positive, and it is determined that one or more general recording criteria, so treatment, days away, etc., occurred and is determined to be work-related as by 1904.5, which is determining the workplace. So, you know, the general, though, presumption is that with OSHA, they are not going to be work-related. You're not expected to take a great deal of investigation into this. You want to, though, ask some questions. How does the employee believe they contracted it? Do they have someone at home or a friend that they spend time with outside of work that came down with it? You want to look at maybe what are their exposures outside of the workplace. And then, you know, OSHA also went as far as to say they very likely could be work-related if you're having, again, these clusters that we talked about with close contact and no alternative explanation. Illness contracted shortly after a lengthy or close exposure to another confirmed case. Close contact with people where there's ongoing community transmission. Conversely, it's not likely work-related if there's only one worker in the general vicinity. Job duties don't include frequent contact with the general public, and outside the workplace, the infected employee associated closely and frequently with non-coworker who has COVID. So again, that comes back to the family. I see we have one question, so I'll try to answer that quickly. If we voluntarily report a COVID case to MSHA as discussed, will any subsequent cases arising at the site be considered reportable? That is a good point, and it's something to consider, and it goes into our next slide. So what is the consequences of over-reporting? You know, there is that first bullet point, an admission that it is happening at your workplace. And obviously, we're concerned, especially when it's voluntary. You know, this can lead to increased scrutiny by MSHA. Also, the presumption that anything else happens. I think that a lot of it is going to be timing. If you have an individual who you report a case to MSHA, and then within the next week you have 4 more cases, it's very possible that, yeah, it is going to be considered that those are going to be then reportable on 7001. If you have a report that goes into MSHA and then 2 months later or 2 weeks later or 3 weeks later, you have one person who comes down with it, I think that there's enough time in there that you are getting away from that. I would also say that if you are going to report voluntarily, you want to go through these steps that OSHA has outlined and that we've talked about today and have some kind of minimal documentation stating that we have investigated this and determined it not to be work-related. Again, though, I think that's part of what you have to weigh is, you know, did you do this analysis and believe that it did not happen at the workplace? And also, what is the time frame that you're going to have another case? Because there is this, you know, 10 days after symptoms, if someone can be cleared, you know, if we have another case 3 weeks later, it obviously wasn't related to that first one, most likely, I think, or maybe they were on different shifts. So we need to look at that, and you need to look at what possibly could be those kind of consequences for over-reporting. Again, remember, it's not required, but I'm just asking for you to do that. So it's going to be one of those company decisions that you need to look at and say, do we really want to provide that information voluntarily? Because you are not required to do so unless it's determined it was work-related. You know, the flip side of that is if you aren't reporting a condition that then comes up maybe due to a complaint, and MSHA comes out and they find that you did have a bunch that you did not report to them, you can be looking at some citations and some enforcement on failure to report. And the same goes true with OSHA here. So, you know, you can get repeat violations with OSHA. With MSHA, that might be something like a 104D, you know, they don't align exactly. Or per instance egregious violations. Again, with MSHA, everything can be a per instance violation. So if they find that you had 7 cases that you didn't report and they determined that they were work-related, you know, that's obviously something that can issue a citation for. But MSHA has taken a very work with us, let's work together perspective on COVID-19 with the mining industry. So I would say if you do have a case and you're wrestling with what to do and whether or not to voluntarily tell MSHA, make sure you go through that work-relatedness analysis and go through it rather closely. The same question, we're looking at it, but for the point of reporting to OSHA, and recording with OSHA and reporting with OSHA is a bit like reporting to MSHA 7001 and immediate notification, although OSHA gets in this and get a bit more time, actually a lot more time, than the 15 minutes for immediate notification that mining gets. So you're going to look at that same analysis, and reporting is only required when there is death or an inpatient hospitalization. If you have a hospitalization, it is only reportable if the employee is admitted to inpatient service for treatment within 24 hours of the work-related exposure that caused the incident. That's pretty unlikely that you're going to have that with COVID. It is possible, but it's pretty unlikely. A fatality is reportable to OSHA if it occurs within 30 days of the work-related exposure. That's obviously a lot more plausible and possible. So something to keep in mind as you look through that on the OSHA side. You know, with MSHA, you have that 15-minute notification. That might apply in this circumstance if you have someone that you determine had COVID and they got it from the workplace and then they were to pass at a later date and time. You would have to notify MSHA within that 15 minutes because it was due to something that happened at work. But again, that's why we want to go through this work-relatedness analysis. So I'll try to finish up here in the next 5 minutes so that I don't keep you all too long, but it is incredibly important that you continue not only to monitor what's happening federally, but your state and local requirements. So, you know, Illinois has done this restore program with multiple phases. As of the end of June, the entire state is in phase 4. You know, they put out guidelines for businesses and employees about what they expect in the workplace. Again, it comes down to similar things we've heard all along: social distancing, face coverings when it's not possible to social distance. They do ask that if you have 2 or more employees that you will replace who have it, that you notify your local public health department. So something to keep in mind. Phase 5, from what I've read, is really going to be reserved for when this is in the clear. So these either a vaccine or herd immunity in the communities have been established. So we're probably going to be in phase 4 for quite a while. It really hasn't probably impacted all of your operations that much, other than determinations on office personnel or non-essential personnel for the mining or industry functions. But keep a look at that. I will say also that the phase, you know, phase 1 was very restrictive, phase 2 is less restrictive, and so on and so forth. You can go the other direction if there's a spike in cases, so it's something to monitor because it might get more stringent as time goes, depending on if cases are spiking. I know in my state, in Ohio, we are expecting that there might be some increases in what's happening or increases in the restrictions due to spikes that have occurred here, and we're seeing similar things in California and Florida and Texas and other states that are experiencing significant increases in rates of exposure and contracting the illness. So again, this plan, though, it was first introduced back in May. Back at the end of May, they were already in phase 3. Now at the end of June, they're in phase 4. So just make sure that you're following along with that. They give specific guidance. You know, there isn't one for construction and mining. You're going to be looking at the manufacturing guidance up here. That's going to be the most suitable, or offices, which could apply to your administrative personnel or office areas. So the last thing to really want to talk about quickly is just that there was an update in workers' compensation. There was an emergency rule passed when this first started. It was a big shift in that there was a presumption of work-relatedness in workers' compensation if a worker who was involved in an essential business or essential worker contracted COVID. Now, it really shifted that burden of proof from a rebuttable presumption to a clear and convincing rebuttable presumption needed to essentially say that this was not work-related. There was significant industry pushback. It was sent back to legislation for renegotiation with stakeholders, which would be management and labor. The new rule has been passed by the Illinois House and Senate, and it's going to be in effect until at least December 31st, 2020. And I I imagine like anything that's going on, there's going to be a reevaluation as those deadlines come up, and they could be extended further. But it allows employers to provide evidence which can rebut a worker's claim that COVID was contracted in the workplace by showing some evidence the workplace was following either CDC or the Illinois Department of Public Health guidance. This is, again, why I was saying earlier, you want to have this exposure control and response plan in place, because that will go a great deal if you can provide a very substantive, very specific document about the actions taken by the company to protect its workforce. It also establishes in this that we're not looking at a home as a workplace, which is beneficial. The individual has to have the contraction confirmed after June 16th by a positive test. It cannot be based just on symptoms alone. So you are looking at more restrictions in what can be applied to the workers' compensation based on COVID contraction. But just know that you have this ability to rebut. There's a rebuttable presumption, which means unless the employer can provide information that it was not contracted at workplace, it will be assumed or presumed to have been. But you can rebut that presumption or that assumption by showing that your workplace was following these CDC or IDPH guidelines. So again, make sure that we're looking at it. That's a very high level review of that law. Just want to make sure it was something that you guys were aware of as you move forward. Again, I welcome you all to reach out with any additional questions right now in the chat, or reach out to me directly. My firm, we have created essentially a COVID-19 task force, we're calling ourselves. It's the workplace safety and the labor and employment attorneys. We provided and put together a great deal of resources. Those are available on our website if you want to help look through those, and maybe they spur more questions, but you might have some answers there. Also, I know you guys have seen, or I've told you about the blog before, but we are continuously posting updates related to COVID-19 in the workplace on all of our blogs. The MSHA Defense Report, which typically focuses on mining, and it still does have a tilt towards the mining industry, but we are cross-publishing our COVID resources so that everyone is getting them quickly. In the event that you want to take a little break from COVID, please join up on the regular webinars. We're going to have another one next week. This will be looking at MSHA and the Federal Mine Safety and Health Review Commission. What is their update? We're going to talk about some of the regulations in the new spring regulatory agenda, which could include a rule on, or will include a rule on silica in the mining industry, as well as powered haulage, and additionally, we'll take a look at some cases that would be impacting. And of course, if there's been any developments on the COVID side between then and now, we'll talk about those. But with that, I really welcome you guys to ask any questions you might have. If you would like to do so, more directly, or go through your facts in a bit more detail, my contact information is on the screen, so please reach out to me whenever you want. And I would be happy to talk with you and look at, or help you guys look at, putting together an exposure control and response plan. So if you have any questions or anything comes up moving forward, or you'd like to talk about the plans and what they should contain, just feel free to reach out to me by phone or email, and happy to chat. Thank you all for joining today, and I look forward to seeing you on some webinars in the future, and hopefully seeing you all in person in the future at some point soon too. Thanks. Have a good day.